Thanks for joining us. We're going to get started in just a minute. But so happy and excited to see so many faces today or this evening. Thanks for being here. All right. Thanks so much, everyone, for being here. We're so excited to have so many experts here today joining us. I recognize a few faces and names. Thanks, everyone, for joining today. I wanted to introduce myself. I am Sandy McKay. I am a general pediatrician and also associate professor in pediatrics at the University of Texas Health Science Center in Houston. I also serve as their division chief for community and general pediatrics, as well as their vice chair for advocacy. I'm also a non-resident fellow at the Baker Institute for Public Policy, and I'm an NIH-funded researcher in firearm injury prevention. I'm also a gun owner, and I serve on the board of directors for Scrubs Addressing the Firearm Epidemic, which goes by the acronym SAFE. And as you can see, we are really excited to bring such an amazing webinar here in collaboration today with this amazing organizations today. So what SAFE is they are dedicated to eliminating the American firearm violence epidemic through research, education, and evidence-based policy. We are a nonprofit organization whose members are U.S. medical students, physicians, nurses, researchers, and healthcare professionals. SAFE is led by an 11 team of board members and our executive director. And I know that we are wanting or hoping that Dr. Joe Sakran will be joining us soon.
He is on now via phone.
He is on. I'm so excited. Yeah. And so I'm going to pitch it over to Dr. Joe Sakran to introduce himself so that we can bring you such a great experience today. So Joe, take it away.
Yeah, thanks so much, Dr. McKay. And I apologize, I'm not on video yet. I'm just calling in from my phone. I'm here on call and locked out of my office, as luck would have it. But it's really exciting to be here with all of you, and hopefully you can hear me okay. As you heard, my name is Joe Sakran. I'm a trauma surgeon at Johns Hopkins Hospital and the executive vice chair of surgery and the director of clinical operations for the Department of Surgery here at Johns Hopkins in Baltimore, Maryland. I also serve as the board chair of Brady and the chief medical officer. And, I think like all of us, we have different connections and things that drive us to do the work that we do. For me, my inspiration really stemmed from nearly being killed at the age of 17 after I was shot in the throat with a 38 caliber bullet. And I think that experience inspired me to go into medicine and to become a trauma surgeon, but also had me thinking as I, went down this professional path, how do I really provide the best medical treatment, which in reality comes out to be prevention. And that's one of the things that we have been doing, at Brady, which is a nationwide organization dedicated to reducing gun violence through advocacy, research, and education. We have over a decade, spent really trying to change the narrative to get people to understand that this issue that we face is a public health issue. There is no one solution or one organization or one individual that's going to solve this problem. It really, takes a multifaceted approach. And that's why at Brady, we focused on preventing gun violence through a variety of different actions. Some have been through, legislative change. Some have been through other programmatic aspects, holding dealers accountable, and really trying to work on how do we have the type of social norm and to the type of cultural change to really impart practices of responsible gun ownership. And hopefully, if we have time, we can kind of get into that. Our comprehensive approach includes, things around firearm safety, community violence intervention, and really trying to empower and provide, the resources for healthcare professionals to really be effective beyond the bedside. And that's some of the stuff that we're going to talk about. In 2018, I think a lot of you probably know the NRA came after, physicians and healthcare professionals as it relates to this issue. And that's where really kind of this, movement of This Is Our Lane was born out of. I'm proud that this organization is now really under Brady, and we have recently launched. We have thousands of healthcare professionals, but we've launched an advisory council not too long ago.
Yeah. So, what I want to do is I want to make sure that we, I think we kind of know logistics at this point, so I think you guys know where things are. Make sure you guys, of course, we all know Zoom etiquette. I think if anything we learned from COVID was, how to find your mute button and to use that effectively. I also want to make sure that we acknowledge and throw a huge shout out to our silver sponsor, which is the Center for Gun Violence Prevention at the University of Texas Health Science Center in Houston. That's led by Dr. Jeff Temple. I also want to shout out to Dr. Temple because he also is leading one of the new CDC funded injury prevention centers that I just wanted to make sure that if anyone wasn't aware of that he's the PI and was awarded that as well. So shout out to him and his group. And we would love to continue to have more sponsors to announce by the end of the event. So don't hesitate to become a sponsor. And I know that link is being put in the chat for you. So if you care about injury prevention and firearm injury prevention, please consider to donate as well. We'd also like to get a sense of who's here with us today, because we know that this is a large audience and sometimes it can be really interesting to know who we're talking to. So we're going to put a poll into the chat just so that we can learn a little bit about who you are, so that we can, better help us, especially as we're navigating through these breakout rooms, to know what the dynamic of the group is. So there's just a few questions in the poll that we have that's going to be put in there. So if you guys wouldn't mind just going ahead and JJ, are we still doing the poll? Is that what we're doing?
Yes, the poll should be dropping.
Excellent. So yeah, just take a minute or two and just share in the poll kind of where you guys are from. So that way, as we can, part of what we want to do is just get to know you guys a little bit as well. And we know where you're from. And that way we also don't have to take a whole bunch of time spending, if we wanted to introduce everybody here on the meeting, that would be like a 3-hour meeting just going through introductions. But we're also super grateful for the turnout of this event. I think it's just really exciting. And I think it's also a testament to how much we all care about this topic and how much we really do want to better the advancement of reducing firearm injury within our communities. So, and also thinking about how, a lot of what we need to do is focus on that advocacy, how we want to continue to advocate for change. So I think some of the things, whenever I think about things in the advocacy world, especially, is how we can advocate for change. And I know one of the things that Joe and I will be talking about is, why does advocacy matter? And I think that's one of the main things that we want to stress to folks here as we start to get to learn and meet all of you guys is what gets you in the game, what makes you want to be a part of this. And Joe very eloquently stressed his background and his goals of what got him in the game. I got in the game decades ago, really, from my time in Missouri, where they really tried to pass legislation that said that physicians couldn't talk about guns in the clinical encounter. And I was like, this is what I do. This is part of my practice. And they started really thinking about that slippery slope of legislative advocacy, and where I, as a physician, I want to be able to talk about anything with my patients. If my patient wants to tell me that they like their toenails painted blue, I want them to feel comfortable with that. I don't want it to just, I don't want any restrictions with my patients. And that's really what struck me is that, and got really passionate with my patients and patient care about how we can be sensitive and look at those encounters and making sure that we are paying attention to what all of our patients need so that we can keep everyone safe. So I think, how we move forward, it's really looking at how we can best partner with our patients and our families. So, and Joe, I'm going to kick it over to you to talk a little bit about why this is so important with gun violence.
Yeah, thanks so much. Can you all hear me okay? Okay, sorry again for the technical difficulties. Well, look, I think Dr. McKay, I think the point about medical advocacy is so critical. And I think when we talk about that, right, really we're referring to the role that healthcare professionals have in influencing policies, raising awareness, and really trying to drive change on public health issues, in this case, right, gun violence prevention. And I think it matters because clinicians have this firsthand experience with the health consequences of various societal challenges. And we bring this unique evidence-based perspective to both policymaking and public health initiatives. We are, the ones, of course, that are, I think, critical in the public health discourse around gun violence, because we're often treating, right, these gunshot victims. We're witnessing the devastating effects of gun violence firsthand. And our direct experience, I think, allows us to speak with an authority on the trauma, the long-term consequences, and the systemic causes of gun violence. I also think that we advocate for preventive measures, right, to be able to help policymakers, right, be informed on public health strategies, and really, I think, providing that credible voice that allows us to humanize the data. It's not just about, these are not, just numbers and statistics, as I always tell people. These are, moms and dads, they're brothers and sisters, they're part of our families, they're part of the social fabric of community. And I think it's so important to remember that. So when you think about, healthcare professionals stepping into the advocacy arena, right? I think there's a few things that we can do. One is, right, raising awareness through education. So healthcare professionals can educate the public, policymakers, and communities about the health implications of gun violence, right? We can use data from our experiences to highlight real life consequences, making these personal statistics relatable. I think the second thing is engaging in policy advocacy. So, right, we can lobby for legislation that promotes, a lot of the things that we're going to talk about tonight: healthcare access, mental health reforms, and so forth. A lot of us have testified, right, before legislative bodies. We've provided expert opinion, and we've collaborated with many groups, whether it's SAFE, Brady, and so many others, to push for these evidence-based policies. The third is doing public speaking and media engagement. I think we have seen that not just around gun violence prevention, but also many other of the social issues that we're facing, leveraging our platforms to really be able to reach a wider audience by telling the stories that we're facing. And I think the fourth is, of course, you've seen just tonight, right, the collaboration with nonprofits and community organizations like SAFE and like Brady. I think that can be incredibly important, right? Working with organizations like Brady allow us to be part of a larger network, right, and infrastructure that's focused on this issue on a daily basis. And then, of course, conducting, and publishing the research that we do. We contribute to the research that's out there. A lot of you on this call, I see, have been part of that contribution. That is so important because it informs, right, the policy decisions that are made. And it also helps establish the credibility and the influence in really both changing the clinical as well as the policy environments. So I think those are all kind of examples of why this is so important. Really engaging in those activities, healthcare professionals can drive meaningful change in public health as well as societal well-being.
And thinking about how we can impact policy change, I think that was one of the tasks that we wanted to apply to everyone that's here today. Is thinking about what's a policy win that we could aim for in the future. And I think that's one of the things we think of in those advocacy world. And so we wanted to give this as a skill building session for everyone. And one of the policies that we we want to give everyone a policy focus, right? So that way, when we give you a skill building session, you have a policy focus to work on. So our policy that we're going to have you focus on is around CAP laws, or child access prevention laws. And so those are one tool in our tool belt that we can use whenever we look at addressing gun violence. So I'm going to give an overview of what CAP laws are for everyone. So kind of like level the playing field. I like to do that whenever we're in large audiences. I know some of you guys are super experts on these things, and so that's awesome. And for those that may not be as in depth on these, here's your primer on this. So CAP laws are at the state level. At this point, we don't have a federal CAP law, but these are criminal liability for negligent storage, right? There are 27 current states and also the District of Columbia that have a form of a CAP law on the books. There's an additional 11 states that have a law that makes it illegal to recklessly provide a firearm to a child. So you can understand the terminology around around the policies, like recklessly provide a firearm to a child. That's not a good thing to do, right? So it's important to understand where the terminologies are. There's a few different types of CAP laws, okay? And it really gets into like what each state has, right? It's whether or not a child could possibly access a firearm, whether a child has already accessed the firearm, or whether the child has to actually use the firearm, right? So there's different levels there. There's also different levels in the CAP laws behind like how old the child has to be, and so there's variations in the ages as well. So this is really where the state's understanding your state law has to be really important. There's great evidence behind CAP laws, and you can see the policy, the evidence that's come out of the CAP laws show that they can decrease pediatric unintentional injury and suicide by 54%. That's huge, right? That's a great way to look at that. And there have been some additional studies looking at these CAP laws that show that they can also be associated with lower rates of firearm homicide as well. So great opportunities for us when we talk to legislators to say, hey, there's good evidence behind these things. So if you're in a state that does not have a CAP law at all, this is a great way to advocate for them. Great low-hanging fruit to sit there and say, hey, we think this is important. If you're in a state that has a CAP law, then this is an opportunity for you to look at like, okay, what type of law is this? What age is it at? Some CAP laws are at age 8, some CAP laws are at age 18. That's a big difference in a child's age. What type of ownership does it require? So this is an opportunity to say, does it make it stronger? Now you're probably thinking in your head, how do I even interpret a CAP law, or where do I know, or where do I find it? That's great. There are people that have already done this for you, because I know my life is busy and it's really hard for me to sit there and have to interpret policies. So you can take a look at the laws and look at some of the different organizations that have done this. Certainly every town has a map, and you can just click on your state and look very quickly, and they've already analyzed that policy for you. Giffords has done this similar thing where you can just look at their website and look at their CAP laws as well. I know that we're putting the links in the chat for you. RAND also has a great publication with the current policies as well. And Brady has amazing pages as well on firearm violence statistics that can also be super helpful as you're arranging your communications. So we will have all those policies in there. And we also have all these links in a leave behind document that we have for you as we go into your breakout sessions. So these are some great tools for you to use. I think the most important thing for you to understand is that these are opportunities for you to identify advocacy, and then we want to make sure that we can build some skill sessions with you. And so you're going to be working in some smaller breakout rooms, so that way you can go with your breakout leader to go through some how to use this advocacy in action and work through some skill building sessions, so that way you feel comfortable addressing this. And we're going to use this example of the CAP law in order to do this. Wow. I think that this is going very well. So I'm excited that we had a great breakout in our group. I'm sure everyone had great breakouts in their
Sandy, can I make
groups.
one comment? Griffin
Yeah.
Dix, who's on the screen here, who is in my group, has passed legislation in California on gun violence and has written a book about it. And I asked him to put his book in the chat so people can learn how he went about doing it. So I thought it was a really impressive story he gave us, and I wanted to make sure we all know how to access his information.
Thank you.
Excellent.
I put it in the chat.
Well, congratulations on that. That's amazing work. Thank you for sharing that.
Thank you.
He also gave a phenomenal podcast interview, I will say, on it, which has links somewhere you can buy his book in it too. So shameless self-promotion, as I am one of the people who interviewed him. And
Yeah. Red, Blue, and Brady.
and Griffin is a rock star. So
Well, as everyone's coming back in, I think we have lots of excitement there, and I hope everyone was able to enjoy some time in their breakout rooms and understand a little bit more about how they can practice some advocacy and feel a little bit less either intimidated or just know some of the different approaches that they can take in that advocacy world, and understand that it is possible to advocate and make some change. And I want to recognize that this is difficult work, right? This is challenging. And I think a lot of times, sometimes it's easy for us to feel like we're not making changes, or like sometimes we feel like you're running up against a brick wall, especially when we're talking about, gun violence advocacy. And there are many days where the days feel long. But I can also tell you that we do make change, and we do make some incremental changes through here. And you have to take the small wins when you can get them, but then also look at this room, and we've got people passing policies and publishing books, and look at the amazing advocates that are just around here. And a lot of this starts at the grassroots, right? And it starts with making those policy changes. It starts with those individual patients and those individual changes that you can make in the office within your patients. And then also being willing to take those stories and take them to those decision makers, and not being afraid to step up and share. So I'm going to go ahead and kick it over to Joe and see, what things came out of your breakout. How did it go?
Well, yeah, I mean, I think our breakout was fantastic. I mean, Dr. McLean did a terrific job of leading the group and providing, I think, a really wonderful overview of the different steps that, each of us could take to really try to kind of be impactful beyond the bedside, as I call it. And we were just, as we were finishing up, one of the things that we were, discussing and starting to talk about was the fact that a lot of times, there's a lot of focus that happens about, trying to push stuff at the federal level. But the reality is that most governing in America happens at the local and state level. And I think just remembering that is really important. So just, for whatever that's worth, like thinking about what's happening in our own backyard, our own community, our cities, our states. And that's why, over the past decade, there's been over, 600 pieces of common sense gun legislation that have been passed in cities and states across America. And I think that's important. So yeah, that was really exciting. And I would just say, both of our organizations, Brady and Safe, are here because we want to, reduce and eliminate gun violence using education, resources that we have, programs, advocacy, and we're happy to kind of be able to partner up, tonight for this event. And I'm just going to throw in the chat for those that are interested, that want to reach out to This Is Our Lane, and be involved. I'll put it in the chat box, and I'm sure Dr. McKay, you can do the same thing as well for Safe. So I'll kick it back over to you.
Well, thanks for joining me today, Joe. This has been a lot of fun. And I hope that we've inspired a few of you guys to reach out to your legislators, feel more comfortable in this. I know that I'm going to speak for Joe in saying that we are here as your resource and as your guide, and we both deeply care about preventing firearm injury in this country, and we are here to help. And I know that Brady and Safe are here to support you guys in your journey as well. So let us know what we can do to help and support you.
Yeah, totally agree. Thanks so much. And thanks for everyone joining us tonight. Sorry about the technical difficulties in the beginning. And we hope to kind of hear from all of you in this journey that we're on together to make communities safer. Thanks so much.